So today, the 344th webinar of IFPH. So in the short notice, we selected a topic to take. So today there is no guest for us. So we all are going to be the guest, the teachers today. So we can share our experience, how a homeopath act as a dentist. So we, as we know, all know, so we often deal with tooth problems in the childhood, in the adolescence, in the teenage, then in the old age. So we often come across so many instances when we manage toothache and the tooth related problems. So I'll tell you some of the instances when we were able to manage the tooth problems. So I'm trying to recollect some of my cases and the related topics. So you all can recollect the cases with you, and after a 15 minutes presentation, you all can add the conditions you manage in your practice. So first of all, I remember a case of toothache. So this a lady of 45 years came with severe migraine. So since 15 years she was suffering with headache. So she consulted so many neurologists of various hospitals in Trivandrum. So with the continuous headache day and night. And she got only relief with analgesics. So daily she had to take 1 or 2 painkillers to manage her. So after 15 years, she developed peptic ulcer and arthritis as a complication of continuous use of this analgesics. So she came, so she consulted, at the same time she started losing weight, she became hot with the loss of sleep, with irregular periods. Now she is at the age of 45. So she got, she became hot, and there was a severe migraine, severe headache after chewing, after eating. And whenever she take hot or cold, all investigations are done. X-rays of the sinuses, so suspecting sinusitis, then CT scan, MRI. So no findings. She had caries teeth in the lower molar, so she consulted a dentist at last. So, and this dentist actually he advised an X-ray. This dentist is a very familiar man, doctor to me, and he often medicines. So he advised an X-ray to this, and he identified an impacted wisdom teeth. That was the point. So it was a turning point in this case. And the third molar at the back of the mouth that don't have enough room to emerge. It is the last adult teeth to come out into the mouth. As we all know, there are 4 wisdom teeth which develops between the age of 17 and 25. So this patient was helped by this dentist to get rid of this headache. So she was diagnosed with migraine, and the dentist extracted this wisdom teeth. It was impacted, and she was completely relieved after this extraction of this wisdom teeth. So this case was saved actually from her migraine never reappeared. That was the first case in my experience I have to tell. So when we come across the therapeutics of toothache, so when pain comes after extraction of teeth, we often prescribe Staphysagra, as we all know. So Staphysagra actually often helps in patients with facial neuralgia. So pain after pain and nervousness after extraction of teeth. Toothache during menses is often helps with, we can handle with Staphysagra. Teeth black and crumbles with the profuse salivation. So as we all know, for profuse salivation, we often think of mersol. Along with the mersol, we have to think of creosote. So you can add Staphysagra also with for profuse salivation. So this after extraction of teeth. So often patient comes with a prosopalgia or so very severe pain in the gums. So I had a case which was managed with the Staphysagra vanam. So years after extraction of teeth, she was suffering with a headache, with this toothache. So she was consulting again and again the dentist, but they were not able to manage that case. And as she came with for some other complaints to the clinic, and I managed with the Staphysagra vanam for that case. Also, we are familiar with another drug for delayed dentition. So every homeopath will tell for delayed dentition, the drug is calcarea force. So calcarea force in biochemic form or in potency, it often helps. Calcarea force 6x often helps for us to manage the delayed dentition in children. Also, a delayed wisdom teeth also is managed with the calcarea force. We often get relief with the calcarea force 6x. Even one or 2 days enough to manage the toothache in such situations. We often get very good result with the calcarea force for delayed dentition in children and for in adolescent period.
question answer
For them, we often prescribe Plantago. Plantago, often tincture, we often put in the sheet for a caries teeth. So I'll tell from my experience, one more drug I wish to add for this caries teeth and for bleeding gums and for halitosis. So calendula tincture, you have to try calendula tincture for all the problems connected with the gums and the teeth. I often get a very interesting result with the calendula tincture. I will tell the case of my own son, the little one. He often refused to brush. So he will brush because he needs a daily new brush. Otherwise, he won't do brushing. So I tried a lot, but finally, so he was so stubborn in the morning. So when we advised him to for brushing the teeth, and so I found very interestingly, daily before going to bed, so I will put a few drops, 3-4 drops in little water, and ask him to gargle. For as a mouthwash, I tried, and very interestingly, he is now 6 years, and now he's often brushed. But this calendula helped him a lot, and I advised so many other doctors, even to my friend dentist. He also started prescribing this calendula as a mouthwash, and very interesting result, very convincing result with this calendula tincture. So that is one point to add to for your knowledge. Then also for bleeding gums, also this calendula will help a lot. we all know Mersol is a very good drug for all these conditions. When the crown decay, we often prescribe Mersol. For toothache, Camomilla is another drug we often prescribe. So as a toothache, if anything warm is taken from coffee during pregnancy, this Camomilla is a very helpful drug with the profuse salivation, especially at night. And calendula is another interesting point I have to add is it is a hemostatic after tooth extraction. So it again it helps in the dentist for arresting the bleeding after extraction of teeth. I narrated about the Mersol. Mersol is a very interesting drug for toothache when crowns decay with the profuse salivation and all the types of taste, especially this sweetish metallic taste. Saliva is fitted with halitosis and coppery taste. So metallic taste, coppery taste, sweetish taste is often covered with the Mersol. This crowd of teeth decay and teeth is loose and feel tender and elongated with the fetid odor from the mouth, as Boric says. And in between, I have to tell. So in some cases, pupil is so there are some swelling, some soft swelling comes in the gums, which we often manage with the Hepar Silicea. In that case also, Mersol also is indicated in such cases. Then I had to tell another drug, which often helps for the gums problems, especially the jaw bones, especially the maxillary bones. You all know Hecla lava, which often helps in gums problems, especially the maxillary bone connected issues. I will tell the gums of abscess with difficulty teething. Whenever there is difficulty teething, Hecla lava is often used. Even there is a paste from our homeopathic industry, which is prepared from Hecla lava, where some doctors often prescribe Hecla lava paste. Then all the exostosis in the jaw bones, nodosities, caries of bone, periostitis, osteosarcoma, bone necrosis, facial neuralgia from caries teeth after extraction. After extraction, if there is neuralgia, as I told you, Staphysaceae often helps in neuralgia after extraction. In that case, Hecla lava is also indicated, and it often helps in patients with the enlargement of maxillary bone. So maxillary bone is the seat of action of Hecla lava, which often helps in. So I tried Hecla lava in a case of osteosarcoma of tibial bone. A girl of 12 years came years back. So even still, she is now 22 or 23 years. She is from the medical college from Trivandrum. She was diagnosed as osteosarcoma, and I was able to manage with the Hecla lava 30 without any metastasis, and still she is perfectly okay. Then I will tell a case of there. So also as a homeopath, we often come across the antidoting property of toothpaste. So George Vitolkas is of the opinion that dental treatment has frequently been observed to antidote the action of remedies. So we often overlook such situations. So we often find the constitutional medicine for patients with a great difficulty. And after giving the medicine, if the patient reports with aggravation, or if there is no relief, we get anguish. So we have to inquire in such situations whether there is any antidoting property or any antidoting factors. So in that situation, you have to think of the paste, what paste they are using, or all the what all dental treatment they were undergoing during our treatment, our homeopathic treatment. If a patient is just beginning homeopathic treatment and knows that the dental treatment is going to be required in the near future, it is best to postpone homeopathic treatment until the dental procedures have been completed. So George Vidorkas is of the opinion that if a person is about to start homeopathic treatment, you have to just advise those person to go and see the dentist so that just overcome or finish all the dental procedures and then come for homeopathy, because all the dental procedures will antidote our medicine. That is the opinion of George Vidorkas. If dental work does become necessary after having received a homeopathic remedy, the amount of anesthetic use should be minimized as much as possible. Also, the dentist should be instructed to avoid using substances with strong aromatic odors, especially oil of cloves or strong mint compounds, as much as possible. So there are instances in which even the mint in toothpaste has been found to antidote remedies. So the mint. So that is a very important point when we come across a constitutional drug treatment. So you have to don't overlook the dental procedures going on between our homeopathic treatment. So that is a point to when I recollected from my understanding. Then I have my own case that when I was at the age of 30. So when I was 13 years old, so there was a case for my premolar, which is the first lower one. The first I filled was at the age of 13, and the second again was infected, the left side. That was also filled after 1 year. So both these were at the age of 23 when I finished my homeopathic studies. So there was I was affected with severe joint pains and bone pains. So especially the whole leg below knees was affected, and I was unable to walk even. So even the slight walking will hurt myself, and so I consulted so many seniors, and they suggested so many drugs. And one of my seniors suggested to take a constitutional drug. So some others suggested some vitamins, some good food, fruits, vegetables. So I tried everything, and finally I found my constitutional drug. So first of all, they advised isonical, then followed with the Cyanesia. So I took both these drugs, isonical followed with the Cyanesia, with within 1 or 2 months. So what happened was my leg pain vanished, but the field, this premolar started pain, and I consulted the dentist, and he took one X-ray, and he advised, so you have to extract this tooth. So after years, around 20 after this, at the age of 30, I filled this, and at the age of 23, after 10 years, it was extracted off. So how our constitutional drug act. So from my understanding, all the constitutional drugs will try to eliminate all the foreign bodies in our body. So I learned such a point in my case itself. So after 3 months, the second premolar was also got infected, and that also was extracted. So how that drug? So use with the caution. Often even Kent often narrates use with the caution this tuberculinum, heparsal, calicar, then Syritia. So this all indicates whenever there is a foreign body, even in heart patients, whenever there is use of pacemaker, sometimes this Syritia or tuberculinum will do harm to such patients. So you have to case the while discussing the past history, you have to go through the such procedures underwent in the person, so that you will use with the caution such drugs. This is Syritia, heparsal, calicar, then tuberculinum often eliminate the foreign bodies. So in my case, this two premolar was eliminated with this Syritia actually. This case I remember. What else? Calcaria floor is the drug of choice in unnatural looseness of teeth with or without pain. Tooth becomes loose in their sockets, and toothache if foot touches the teeth. The glassy appearance of the teeth often gets relieved with this calcaria floor, especially this biochemic continuous use will help the looseness of teeth. So that also is a drug of choice. So these are the cases or the therapeutics I came across. So those who can add, so many masters, so many experienced doctors are here to tell their experience. So I invite the senior doctors with their knowledge you can share in this platform. So today you people are the teachers today. So I invite the senior doctors, so you can hand raise and narrate your experience in this platform, please. Harihara Narayanan, please. Please come forward to tell your experience, please.
Hello. Hello, can you hear me?
Yes, yes, please.
Sir, you have got a lot of experience regarding dentistry. Say one or two clues from my experience. I am ready to share. One experience, you know, certain children have the yellow color of lung, yellow color of the teeth, yellow color of the teeth. Certain children have yellow color of the teeth. See, it is Merxol is the best remedy for that yellow color. One of the clue. Then another is, see, you said the pain regarding with the dental problems. That the trigeminal neuralgia, it is where when it is connected with dentistry, bell 1 to 10 it is very good remedy. Bell 1 to 10 we can increase the potency. See, another my experience is, see, after extraction of the tooth, you give arnica 1 3 times a day, and along with that you give a piece. Pain will relieve suddenly. See, and you can use hypericum 1 daily 1 dose for 7 days. It will give very good relief to the patient. See, and another thing is, another important clue is disintegration of the tooth. Disintegration of the tooth. That for that Syritia high potency. I mean 10 is a very good remedy. See, next is bad smell of mouth. Bad smell of the mouth. See, Merxol is the remedy. Merxol is the remedy. See, most of our children have the dental problems because their calcium metabolism is indefective. So you can give Calcarea car 10 one dose. These are my experience. And along with that, along with your experience, please, you can include my experience also. Okay,
Yes,
thank you very much.
very helpful additions. Please, Dr. Hariharan. So, from your experience, you added some more drugs.
Other doctors,
Other doctors, please. Dr. Fadran, please raise your hands. Senior doctors, please raise your hand and narrate your experience.
Thank you, sir, for the chance given me to comment in this regard. I have experience with some. When I was a final year student, I had a severe toothache, and I tried very
It's not clear. Your voice is not clear. Some problem with your connection.
any problem?
Some net issues is there.
Can't you hear?
Yeah. Now it is clear.
Now it's clear. I tried very bad for toothache. For this toothache. For that, with that toothache, I couldn't sleep for 2 days. First day I didn't sleep. Second day I took medicines. First day I consulted the dentist. He told me that to take homeo medicine. It will do. I tried with medicines, and at 4 o'clock I think in the early morning, I tried all medicines as Merxol, Belladonna, every medicine, and everything. Finally, I took 1 dose of chamomile at 200 and took another dose besides me to take after 1 hour. But that first dose instantly cured the toothache. I didn't consume the second dose. That's my experience with chamomile. I usually give chamomile one to patients. They doesn't need any change of medicine afterwards. I have tried it very good results. Then I had a looseness of teeth when I was studying at Great Beach in Australia. When I was coming from free area, I went to that government dental college, and the principal was a close neighbor of mine, and she advised me to take. She immediately took 1 tooth. That tooth, I think, was intact. I took medicines, homeo medicines only afterwards. Then after 2 weeks, I had a severe looseness of teeth and toothache. I took mercurius Merxol. That cured the toothache. Now, I had only one. I know. One is RCT. One RCT is done, and now I think my teeth are all my teeth are okay with no pain. I can masticate well. Then, as regards, I had a toothache when after filling my teeth temporarily for RCT. Severe pain. I couldn't sleep. But at that time, I noted that I got relief by holding cold water in the mouth. I went to Trivandrum to see the dentist. I took some IPs in my car, and whenever the water gets heated, I felt pain. Then I thought of taking Pulsatilla. Pulsatilla single dose gave me very good relief, and on continuation, no pain had. But the filling was allergic to me. That was cleared by the dentist, and another filling in RCT was done. Afterwards, there's no complaint in the teeth. You need like Pulsatilla, Coffea cruda is of the same modality. Fermentation by cold water, ice piece, etc. Aggravation by hot. No, aggravation by cold is indication of mercurius and chamomilla. They both get aggravated by cold application. Then dentition troubles, that's already mentioned by Dr. Yahya. And calcium is a very good remedy for teething trouble and later option of teeth. Then, discoloration of teeth, Dr. Hariharan has mentioned Mersol. It's also very good. I usually advise patients to use charcoal, this umi, for getting brightness of teeth. It's marvelous any dental cream or dental powder. Then that's all I have to stick in this again. I think add anything if I remember afterwards. Thank you.
Okay, thank you, Dr. Fadran, for your additions. Now, Dr. Pranav, so please.
Namaste to everyone in this group. I am Dr. Pranav from Bengaluru. Am I audible, sir? Thank you. Sir, this was the case when I was in my first year. I didn't know much of therapeutic use of FD remedies. Initially, I had this tooth decay complaint. So my doctor had given me Staphysagrria 200, but at that point of time, it didn't help me. So I had a dilution in my home and a few other dilutions at my home. So that helped me in the cases later. So then what happened was, when I was in first year, my mom had the same tooth complaints. She's apparently healthy, but she used to get multiple tooth complaints, multiple tooth decays. So in my first year, I didn't know what to do. So I had taken her to the dentist, and they had told that we should be removing 3 tooths from her mouth. The 2 molars should be removed, and 1 incisor should be removed. That was the case. And later, the procedure was done. 1 molar was removed at one point of time, and all antibiotics were given, painkillers were given, but it was in the night around some 11 o'clock in the night. It was a Sunday night, and even though painkillers were given and antibiotics were given, the pain was so severe that she couldn't even resist. She went into chills. She went into very severe agony for almost for 2 hours. And in my first year, I didn't have many remedies. So I just had some hypericum macphos. So I tried to alternate it. That too didn't work. And later I had to go to the pharmacy around 4 kilometers from here in my cycle, and I had to get some medicines I had given her. Then to the pain didn't subside. This struggle went on to until 3 a.m. in the early morning. That is the Monday early morning. So I didn't have any hope on homeopathy in dentistry. But after a month, my mom complained of again a pain in the other molar. So I thought we are not having anything. So let us go to the dentist and let us get it removed, or whatever procedure needs to be done. But at that time, my younger brother observed that the tooth pain comes only during the menses, just during the menses. So I was in my second year, no, first year at that point of time. So I had a practice of going through this boric, even though I didn't understand many things. We didn't have the exposure to refer it at that point of time. I just used to refer these books. At that time, I saw only single remedy was given. The two, the grade was less only, and the remedy was Staphylococcus agria. So I give Staphylococcus agria 1 dose, and I thought of repeating it 4 times a day and all. But in 1 dose, she responded well. That I had to stop the remedy because she didn't get any other attack after that. But fortunately, what happened was for 1 year she could survive with almost 50% decayed tooth, and later by mistake there was a stone in the foot. That when she chewed, the decayed bone got broke up. So I had to take her to the dentist for the proper removal, because the broken part was too sharp that it was cutting her tongue and it was bleeding. It was a very irregular cut. It was so injurious to her. So when I took her to the dentist, so what happened was they knowing that I'm studying homeopathy, he asked me to give our medicines, and he told that he would do the procedures and he would let us to treat. So with that deal, uh, I started with Staphylococcus agria and continued it with the calendula 30, and with that the procedure was over and she didn't have any pain. Even post procedure she didn't have pain. Even previous to procedure, the pain and the other complications were cut down. And after this, she never had any other teeth issues. This was my little experience in homeopathy, sir. Thank you.
Okay, thank you. Now, then Dr. Rajan, please come forward.
Doctor here covered most of the problem in dentistry. Thank you for your caring experience. I have had one medicine for ailments from molar tooth, wisdom tooth ailment. One of the best medicine is Chidiantha cherry tincture. It's very useful for complaints ailments from wisdom tooth. Chidiantha cherry. Another remedy I have to add to the toothache during pregnancy, magnesium carbonate best medicine for toothache during pregnancy. No, this is my adding to your class.
Okay, thank you, Dr. Rajan.
How many Gupta doctors?
Please come forward. Please raise your hand and come forward.
Lokmani Gupta, President.
Lakmani, oh, it's Dr. Lakmani Gupta, please.
Hello, sir. Am I audible?
Yes, yes, sir. Yes, sir.
Very good, sir. Good wishes to all. After 2-3 days, I was unable to listen all, and I was missing it very much. Sir, it's a very good platform. 2-3 experiences I would like to share with dentistry. So, one of my very good friend is a dentist, and I told him about arnica and hemorrhages to prevent and stop the bleedings after tooth extraction. So he tried both the medicines. I told him some valuable differences in between the two, and still today he is using these two medicines to prevent the gum bleedings after tooth extraction. They are giving very good results to prevent the bleeding and to prevent even the pain and swellings. Even in the cases of some spasm develops when they ask, open the mouth, open the mouth, open the mouth to plug the tooth out. And sometimes some patient gets spasm in the jaws. So while giving arnica at this phase, this sort of spasm are less. Secondly, sir, in my clinical practice, I experienced very good results with chamomilla, allium cepa, and staphysagra in cases of these pains, referred pains in the teeth when decay is there or some neuralgia is there. These three medicines proved very good. One of my friend described staphysagra very much. I found staphysagra very useful to bring the moles out. Sometimes the molar teeth take plenty of time, a longer time to comes out, and the young youth feels very terrible pains. I used to ask them for alum gargles, फिटकरी के कुल्ले करें और staphysagra I use with them. The molars come out very easily. And as we all know, creosote gives very good plug of creosote mother tincture in the decayed tooth covers the pain with it. Thank you, sir. This is what I have to explain here.
Thank you. Thank you, doctor. Next is Hubert. Dr. Hubert.
Can you hear me?
Yes, sir.
I have some experiences. I have a good friend of mine. He is a dentist. He asked me, sometime he may ask, he asked me that he wants some medicine because some patients are very much irritable. They are allergic towards their medicines, allopathic medicines. In such conditions, what to do? But at that time, I asked him, what you do if there is a shock, if coming in such condition, if you are taking extracting a tooth that time or doing anything that time, what you will do? He asked me that is it such a condition will come? Yeah. I told him that yes, such condition. In such conditions, we have to use arsenic alba and aconite in such cases. Once he was taking extracting a tooth, that time it is happened that the patient was collapsed. He took his in the hospital, and suddenly I gave him some arnica and the aconite and he dropped more than enough medication on his in his mouth, and I don't know. He sent her to some hospital, and she was rescued. That time he asked me what to do in such conditions, extracting a tooth or they are piercing. That time they are drilling that. That time I told them, you take before that, if there is any condition in such conditions, you give some phosphorus. I did not told him what is phosphorus. I given him phosphorus in bottles. Some medicines I given him to take such conditions. It was helpful for many times. He sent patients, if there is any allergic towards allopathic medicines, they could not use medicines. That condition, he will send me. That time I shall give some medicines. I am using, you know that my methods are different. Bell arnica macphos. Tuja. Creosote. In such conditions, the root of, is there any decaying or any damages or pathological conditions, if like pyorrhea and that conditions, I use. My method I will use. You can, this other medicine, creosote and tuja with bell arnica macphosis. In such conditions, in emergencies, we can use. That's what I want to say. In it is in the Onam or 200 we can use, and Onam also can be used. Aconite, arnica, macphos, and belladonna. These are the things I want to add.
Thank you, Dr. Hubert. Next, Dr. Manoj, Dr. Anil, Dr. Shaji Kuriel, Dr. Jose Isak. You also have to add. Please
I
come
am
forward.
not free.
Okay.
Patients in front of me.
Okay, but I am free. Okay.
Excuse.
Yes, Dr. Manoj, please.
Very nice presentation, Dr. Yahya. And I think the more important thing is he brought the attention to the usage of this different types of toothpaste that will often provide harmful to our medicines. Very important thing. And I mentioned about this in the chronic diseases, we are using the scented waters and so many things. Then in the case of the snuff, we use snuffles. So snuffs are more dangerous than cigarettes, where it is because of the use of the tobacco scented materials. That's an important thing. Then another thing, I think the borax is an important medicine. When there is ulcerations in the gums after using the artificial dentures, often the patient develop. In the old age patients, they will replace the artificial dentures. They are likely to produce the ulcers where the borax is a medicine. Then about the Heclala is an important medicine, as you mentioned, for the damage of bone. Then another thing I has noted that to prevent the caries of tooth, they are mentioning in the Kopka in Boris Material Medica, but I don't have much experience on that. Medicine is Kopka to prevent the caries of teeth. Then another thing, the halitosis, the offensive smell from mouth. I think there are some theory that if there is excessive mental tensions, then the patient will have this halitosis or the offensive smell from mouth. It's often indicated. Then another, I think the three tri-offensive medicines can be used in these aspects. One is the Nitrosoltum, then Dapicia, then the Savisagria. All these medicines can be used for the use of this offensive. Sorry, not Savisagria, Mercury. It's an important thing. So that's all. I have only limited experiences or I not at all paid much attention to that part. That may be the reason. Okay, thank you.
Okay, thank you. Thank you, Dr. Manoj.
I think Joe Isaac sir is ready to say something. Body language is clear.
See now, like many veterinary doctors, many dentists are also using homeopathy. Not only in India, in Europe, and many places, and some dentists started studying homeopathy also now. Already, Dr. Yahya has said everything. I just wanted to add 1 or 2 points because nowadays patients are coming after this root canal treatment with severe neuralgia. What they say is they did the root canal treatment 6 months back, and after that there is severe pain on that part. And usually I think what happens is while drilling that part, they injure some nerves or something, and our hypericum works very well. One remedy which I have found very useful, because maybe it is due to the trauma or injury to the nerves. Hypericum is working very well. Another thing which I have seen is during the wisdom teeth eruption, many people have some problems, and they complain of severe pain, numbness, many things. And usually this, they go to the dentist and they say that you have to remove on the top there is some bone or gum which you have to cut and do some surgery and remove this wisdom tooth. Usually when there is a problem with the wisdom tooth, they say it is better to remove this wisdom tooth. But our medicines can work very well, especially calcarea fos. The first remedy is calcarea fos, which I have found useful. The second remedy which I found useful is causticum. Then coming to the this jaw or this gums, many people nowadays have severe offensive smell, gingivitis, and that is a syphilitic trait, and usually Maraxol works very well. Even this toothache also, my best remedy is Maraxol. Other remedies are there. Then the milk teeth. In some children, what we see is the milk teeth caries is there, and very fast it becomes black and gets destroyed very soon. So that one is one remedy which I often use is creosote. Creosote works very well, especially when you go from 30 to 100 1 and The milk teeth is already gone, but the second one, the next one will be much better and there won't be any problem. So creosote, and then you can think of calcareophos also, because calcareophos is found to be the number one in dentition. Any dentition problems, calcareophos is found to be the number one. So that's all what I wanted to add, because already Dr. Yahya has talked about it in detail, so I don't want to go into that.
Yes.
I think we can Kathy Lemon from US. She's not attended. She's there.
Kathy Lemon.
Then after comes from Turkey, there.
Yes, you can share. You can share your experience, Dr. Kathy Lemon.
She was there. Not all.
Danish, Dr. Danish. Dr. Binduraj.
Another one I can add to it, that in pores in tooth, we can apply in a cotton. We took camphor and we can use it as a local application for to remove, to give relief to such severe pain. And if there is any hypertension, we can reduce hypertension by that time as a measure. Revolvia is useful. If there is pressure, more pressure in the area, that time Revolvia mother tincture will help some extent.
Yes, I don't have a whole lot to add to this. Although I think I'll recommend. I'm enjoying taking in what all has been shared. I haven't had a whole lot of experience myself with dental homeopathy, but everything that I've been hearing is very good. I would like a review of, because I came in late, I came in at the end of what was being shared about Hecla lava. So I would like to hear that again. But what I'd like to share too is that I have a dentist here, and I'm in the Dallas, Texas area in the United States, but I have a dentist here who she's called a biologic dentist. She's a fully natural dentist and she loves homeopathy. I've been helping her as she's needed it. She's studied homeopathy to a small degree, but she likes using homeopathy as she can. I'm hearing what's being shared as far as experience in dentistry, and I'm wondering if maybe I might, would there be interest in that, perhaps asking her if she would be willing to speak? I don't know if she is, because she's got a very, very busy practice, but I'd be happy to ask her if there is interest in this.
Definitely, you can suggest her and bring her details to us so that we can have one-day presentation here.
Okay, okay. Yeah, that's about all that I have then. I'm enjoying what I'm hearing. Thank you very much.
Thank you.
Okay, who else?
Dr. Steve Paul on slice hat.
No one else.
I wish to just add one important point regarding teeth problems. So it's a general management, and it is nothing but the vitamin D deficiency, which we need to check in dental matters, because calcium metabolism is mainly dependent on vitamin D, and many doctors, including me, identified vitamin D deficiency later on, which were lacking attention from myself also. So that because exposure to sunlight was very minimal, and that is an important area when we get into clinical practice, always sitting inside the room. Exposure to sunlight become very minimal, and that is an area we need to all look into. Then medicine application, I think almost majority of areas are touched. Only one or two things I may wish to add is toothache relieved by warm water, warm drinks is Magphos. 6x I used to give arsenic album, restores and relieved by cold water, mainly phosphorus, silesia. These are all general applications. That's all. Almost all areas are touched. This vitamin D deficiency is also important in completely correcting. Take note of that area also. And the thing is, in children, the dental caries become too early and too deep when they become more insecure. That insecurity can add to earlier and deep tooth decay. These are something I wish to share, in addition to what all of you mentioned.
Okay, so it is a time to wind up. So Dr. Shajit, you can wind up by a lot of thanks.
Yeah, I just wish to an announcement that we have one more date of our Said Sar's, Ismail Said Sar's fundraising activity remaining. So I appreciate those who wish to contribute to our fundraising program. Please contribute so that this participation in our President Said Sar's webinar will be a way of contributing to our activities, and also agrocare webinar by Dr. Abdul Latif sir, who is a patron of IFPH. So please join our programs so that our fundraising activity becomes successful. So I thank all those who participated today, and especially Dr. Yahya for his presentation on dentistry, which was, I think, will be helpful to many. So thank you, Dr. Yahya, and all those who participated today. I thank all of you on behalf of IFPH. Now, it is time to wind up. So please remember, our English session begins at the 8 p.m. Starting our 340th day onwards. We started it on 8 p.m. instead of 8:30 p.m. Indian time. Please take note of that time difference. So please be ready to join us earlier so that you will be listening from the beginning of our presentations. So our 365 day celebrations are nearing. We appreciate your full participation and joining us with your opinions. And also we'll be filing some cases in the court of law to protect homeopathy, the status and rights of homeopathy in the state of Kerala. So we need your full wholehearted support in whatever way needed. So be prepared to assist and help us in all the concerns coming on our way. With this, I once again thanking all of you, those who participated today, and Dr. Yahya for selecting this topic. And the moderator for next session in the local language Malayalam can take over the session. Over to you, Dr. Danish.